I'm Dr. Nadeem Sajjad Raja. Edema. Edema means swelling caused by fluid in your body's tissues. It usually occurs in the feet, ankles, and legs, but it can involve your entire body. What are the causes of edema? Eating too much salt, sunburn, heart failure, kidney disease, liver problems from cirrhosis, pregnancy, problem with lymph nodes, especially after removal of breast, some medicines, standing or walking a lot when the weather is warm. So what are the signs and symptoms of edema? Swelling or puffiness of the tissues right under the skin, especially in legs or arms, stretched or shiny skin, skin that holds a dimple after, also known as pitting, after it has been pressed for a few seconds. Swelling of the belly, also called the abdomen, so that it is bigger than usual. Feeling of leg heaviness when you need to see a doctor. So make an appointment to see a healthcare provider for swelling, stretched or shiny skin, or skin that holds a dimple after being pressed. See a provider right away without any delay if you are suffering with shortness of breath, irregular heartbeat, chest pain. These can be signs of fluid buildup in the lungs, also known as pulmonary edema. It can be life-threatening and needs quick treatment. After sitting for a long time, such as on a long flight, call your care provider if you get leg pain and swelling that won't go away, especially if the pain and swelling is on one side. These can be symptoms of a blood clot deep in the vein, also called as deep vein thrombosis or DVT. To keep swelling down, your healthcare provider may recommend keeping your legs raised when sitting, wearing support stockings, limiting how much salt you eat, or taking a medicine called a diuretic, also called a water pill. Thank you very much for watching this video.